Suicidal ideation is when a child is experiencing thoughts of wanting to kill themselves. So those would be thoughts like, I want to kill myself. That is considered active suicidal thoughts. And thoughts like, I wish I was hit by a bus, or I wish I could go to sleep and not wake up. Those are more passive suicidal thoughts, but both are considered suicidal thoughts. Signs and symptoms of suicidal ideation are any time a child brings up suicidal thoughts in any nature, whether that's directly, subtly, in a joke. And then sometimes another sign is if they're withdrawing and isolating when that's not their norm, or if they are very involved in other people's problems, because that's kind of a way to avoid their own problems. When a child is in an immediate crisis situation, the first thing you do is assess, is this the kind of crisis that requires 911, where they're in immediate danger to themselves or others. At that point, you can access 911, you can access the emergency room or a crisis center at the community mental health center. If they are not in immediate crisis, then you can also call your outpatient provider or reach out to outpatient services like their primary care doctor and places that are not crisis centers. With children that have suicidal thoughts, they can start having them as early as weird as it sounds, 5 years old. They don't understand at that age that is permanent. So that's why it's such a high risk, no matter how young, no matter how passive or joking they are about the subject, you still have to take every single comment seriously, approach the conversation, but not in a way that threatens the safety. Because the important thing is making the child feel like you are not going to judge them and that they're not going to be upsetting you by talking about it.